Carpal tunnel syndrome is a common condition that affects millions of people worldwide. It can develop gradually and often starts with mild symptoms. It causes pain, numbness, and tingling in the hand and fingers, which can be particularly bothersome during the night or after activities that involve the wrist. This happens when the median nerve, which runs from your forearm through a passage in your wrist called the carpal tunnel, gets compressed. The compression can be due to various factors, including repetitive hand movements, wrist anatomy, or underlying health conditions. Several tests can be done at home to check for carpal tunnel syndrome. These include the Phalen's test and Tinel's sign test, which can help identify the presence of nerve compression. These tests are not a substitute for a doctor's diagnosis, but can be helpful indicators. If you suspect you have carpal tunnel syndrome, it is important to consult a healthcare professional for a comprehensive evaluation and appropriate treatment options. The Tinel's sign test is a simple way to assess for carpal tunnel syndrome. To perform the test, you lightly tap over the median nerve at your wrist. The median nerve runs through the carpal tunnel, and tapping it can reproduce the symptoms of carpal tunnel syndrome. Another test for carpal tunnel syndrome is Phalen's test. This test is commonly used to diagnose the condition by evaluating the pressure in the carpal tunnel. To do this test, you hold your forearms upright, ensuring they are parallel to each other, and press the backs of your hands together firmly, creating a right angle with your wrists. You should hold this position for 30 to 60 seconds, maintaining the pressure throughout the duration. This position increases pressure in the carpal tunnel and can cause symptoms such as tingling, numbness, or pain in the fingers and hand. Durkan's carpal compression test involves applying direct pressure to the median nerve at the wrist for up to 30 seconds. This test is often used to diagnose carpal tunnel syndrome, a condition that can cause pain, numbness, and tingling in the hand and arm. The clinician will apply pressure to the wrist and observe any symptoms that arise. If the patient experiences tingling or numbness in the thumb, index, middle, and part of the ring finger, it may indicate a positive result for carpal tunnel syndrome. A positive result for Tinel's sign, Phalen's test, or Durkan's test is a tingling sensation or numbness in the thumb, index, middle, and part of the ring finger. These tests are commonly used together to increase the accuracy of the diagnosis. Each test targets the median nerve in a different way, providing a comprehensive assessment of nerve function. While these tests can be helpful indicators, it's important to remember that they are not a substitute for a proper medical evaluation. A healthcare professional will consider your medical history, symptoms, and may order additional tests such as nerve conduction studies or electromyography to confirm the diagnosis. If you experience persistent symptoms, it's crucial to consult with a healthcare professional for an accurate diagnosis and to discuss treatment options. Treatment may include wrist splinting, anti-inflammatory medications, physical therapy, or, in severe cases, surgery. Early diagnosis and treatment can help prevent further complications and improve your quality of life. Taking proactive steps can lead to better outcomes and help you manage your symptoms effectively.